are you using the Multiscan in your practice, and why do you use the Multiscan in your practice?
I use it as a sort of a first line of defense in the sense that everybody that comes in gets a scan, and then we have many people that are, if they come in with strict, say, pain, like a knee pain, a back pain, a neck pain, something of that sort, headaches, they still become curious because I like to call it the full body scan, and I like to describe that and say that it's not a picture of organs showing you tumors. It's actually a tissue level measurement of your full body function. It's not used to diagnose disease. It's used as a monitoring device for your health. So, so we use it usually when people come in after our consultation. We will then do a full body scan, and it's wonderful because you can see full body physiology all in one sitting. The scan really improves a person's compliance. When you see things that are very compelling about your own body function and physiology, you're more apt to do what you need to do to really get those things to change and improve and heal. So the word in my practice that I never ever use, I never use the word treat, cure. It's always about a person's ability to heal, because right from the first consultation, we talk about my role in their healthcare and their role. My role is not, I'm not the real doctor for this patient. I always tell them, you're the real doctor. The real curing, treating, and healing always comes from inside out of your body. And I like to say and demonstrate that it's neurologically controlled. So we're looking for root causes within your body function. And I usually use an example of a wilting or a sick plant. If I set it on the desk, a person would know what to do. They would give it some water, they would give it some sunshine, change the soil, and the plant comes back vibrant. I said, why don't we take that approach to a person's health? Let's give your body back what's missing. Take away things that are interfering, and wow, the body actually comes back into balance and actually heals. What a concept. So I don't have treatment programs. I don't treat. We actually do these things, discover root causes. And we also heavily talk about lifestyle changes, because if someone still does all the right stuff, they take the right nutrition, they get biocranial, which is one of the big things that we do. It's a jump start to the brain, central nervous system. It really does improve brain function. And we do some other things that we do. People actually end up healing, but if they don't change their health habits that have caused those issues, it comes back. And I really like to describe that and discuss that with people and give them little step-by-step, easy things to do to really change their health and wellness permanently. So, because we can say that you definitely don't know what you need to do, and you certainly have an excuse. But after we go over everything, you have no more excuses to really improve your health. So.
Well, it's interesting that you have such a unique way of looking at patients that most people aren't used to, I think, out in the world of medicine, simply because you're not looking at the parts that are a problem, but looking at the whole person. And I see that you're doing a lot with the Multiscan to understand that, like maybe a missing piece out there that we now have that can help you as a doctor and other doctors understand their patients like in a really quick time frame. Are you finding this system to use? Do you find it difficult to understand and to use?
You can keep the scan and the results from the scan as simplistic or as complicated as you like. It just depends on how you approach a person's health. So I think I language it very well. When I sit down with a patient, we're doing a report of findings, we'll do a scan, and then we'll sit down afterwards and do the report of findings. And something special that we do with the report of findings that's a little bit different too is I actually record our report of findings. I have a screen capture software, a video screen capture software that we record the screen so we can see the scan result, and I'm recording our conversation, the audio, and then I'll take that afterwards after we're done, and I'll upload that to YouTube and upload it unlisted, and then I just send them the link to it so that therefore they can show their family, explain it to their husband or their wife, and they might want to review it as well because we cover so much information. I do this every day, all day, so it's easy for me, but when we when the husband says, well, what do you say about such and such? She can immediately go back to the video and say, well, here, listen to it or watch it. And so it does. I think it's a powerful explanation. It keeps them more on track. And patients have really, really appreciated that too.
That's fantastic. I think doctors really love hearing what you're doing in your practice. Everybody loves to know what successful doctors are doing and what's really helping people. And, you know, unfortunately, we haven't ever really had the complete technology along with all the other testing to have the physiological testing. So I'm glad that we can have a part in that where you can see and start monitoring your patient care and have a baseline and then, you know, go from there. So I would love for you to show us some cases if you're ready for that.